This is ASAP Pathway. Welcome back, my friends. I am really excited. I always say that, and I'm like, what else can I say other than I'm really excited to have my guests today with us? But I am. I'm always excited. So somebody probably rolled their eyes. We have the one and only Dr. Claudia Pinter with us today. Welcome.
Thank you. Thank you so much. It's such an honor to be here. I really appreciate what you do with the ASAP pathway. I think treating children is the most important. And I want to serve your audience, you. I want to support your mission. So I'm very honored to be here.
Well, I'm honored to have you. And let's talk about the time zone difference really quick because I am challenged with time zones. So it's about 8 a.m. here. What time is it where you're at in Vienna?
So here in Vienna, it's 3 p.m.
3
Yeah,
p.m. Okay, well, thanks for taking your afternoon with me. I would
my
love
pleasure,
to
Stacy.
introduce you to the audience for those that may not be familiar with you. She's an orthodontist internationally recognized for her expertise in aligner therapy and skeletal maxillary expansion. She began her dental studies at the University of, okay, it's got an umlaut over there. Okay, so is it Würzburg?
Wow, that's actually perfect.
Oh, was
Yeah.
it? Okay, because the W's are V. I went to Germany this summer, so I learned a few things. So the University of Würzburg and completed her degree with distinction at the University of Vienna. She practices in the heart of Vienna with a clinical focus on bone-borne expanders and aligners to optimize breathing, bite, and facial aesthetics. Beyond her clinical work, she is actively engaged in research and education. She serves as visiting faculty at Nova Southeastern University and as course director of the Fellowship in Aligner Orthodontics with RIPE Global. In 2024, she received the award for Best Aligner Case at the European Aligner Society Congress and has published in leading orthodontic journals. Quite accomplished. And I found out you just were speaking at St. Louis University and I in my town and I missed you. So we were talking before recording that we'll have to get together the next time you come. St. Louis University's orthodontic program is pretty amazing. And Dr. Kim is pretty amazing. I'll give him a shout out. And he brings in, I mean, one year he brought in Audrey, he's bringing in you, which says a lot about his progressiveness, his openness. So I'm appreciative of that.
Yeah, me too. It was such an honor to be there, and see
What was
how.
your topic?
So I was talking about aligners, aligner biomechanics. And it was really cool because I presented my work and how students can achieve great results using aligners even in complex malocclusions because aligners are often said to be only suitable for mild cases. And at the end, one of the professors who's also an examiner at the AEBO, the American Board of Orthodontics, he said, I would like to see that good finishing in the braces cases that we're seeing for an examination. So that was really a huge honor for me to have someone say that to me. I pay a lot of attention to details, and I'm lucky to have patients who are also willing to work with me towards that really nice result. And I got the chance to talk about that.
Well, the fact that you received the award for best aligner case at a European Aligner Congress, like that's pretty amazing. That is an amazing accomplishment. And aligners have come a long way, but just because the ClinCheck comes back a certain way, it doesn't mean the teeth are going to move the way it says. So, which I have learned the hard way, right, over the years. But so you have to understand the mechanics that you're working with, the physics, what is possible, how to put your attachments in, what movements. There's a lot that goes into it's not, and again, brackets and wires, you have to know things as well. But I think aligner therapy, it really I've had people push back and say, oh, you just throw aligners in. I'm like, look, there's more case workup to me that goes into aligner therapy at times than sometimes with traditional braces. Would you agree to that?
Absolutely. I think you also have more flexibility with the aligners because with braces, it's you throw on or you put on the braces and it's not as customizable as with aligners. And I also treat mainly adults, and I want to respect their preferences, like no attachments on front teeth or stuff like that. And that's a challenge for me that I'm willing to accept. So I try to make it as aesthetic as possible and still achieve the best results. My goal was always I want to achieve the same result that I could achieve with braces or even better.
Mm.
And yeah. So yeah, at the European Aligner Congress, I was really honored because there were people, were a bunch of people from Japan competing, and different Sandra Ties. I really didn't expect that.
Sandra Ty. Oh, she's a
Yeah,
hitter. Yeah.
yeah. So that was I know that everybody deserved that award. I was lucky enough to get it in the end, but I got to see the work of my colleagues, and I can only tell you it's impressive what other people are doing with aligners.
Well, don't you find when you're in situations like that, yes, it's a competition of sorts, but there's this camaraderie there because you're all doing something and have a very similar passion. And it really, I know for me anyway, it drives me to be better. It drives me, I appreciate what my colleagues are doing. I see what is possible. I always know that there's always more to learn. There's always room for improvement in my life, whether it's clinical, professional or personal. So I feel being in situations like that, it just is a kind of it builds, you build, you
Mm.
feed off each other. And I do love environments like that. It's a lot of fun. It's a lot of fun. I want to dive into, you're an orthodontist. I do not know in Vienna. I do not know the temperature or the environment of what orthodontics is like in your region. And if what you're doing is unique, I'm going to assume it is because I think what you're doing is, I know what you're doing is unique here in the United States. And, but I know some areas can be a little more progressive than others. And the US just seems to, we're coming along with Airway and orthodontics. But what's it like in your community? And to be someone that's doing, and I guess I should have told the audience this because I didn't really talk about it as much, but I know you're bone-born expanders and aligners, which we mentioned in your bio, but the reason you are not just aesthetics, but there's an airway benefit that you have found. And so you've implemented this in your practice. What made you do that? And is this unique in your community?
So, Stacy, this is such an interesting question that has been with me for the last few weeks as I'm preparing my next lecture. Because you know what's so interesting? You like my profession in most countries, it's called orthodontist. Orthodontist. However, if the German word is Kieferorthopäde, so if you translated it word for word, the profession would not be orthodontist, it would be jaw orthopedist.
Interesting.
It's so interesting. So
Way
it
to
also
go,
creates
Germany. Or Vienna.
it's just in the German. It's so interesting. It's just in the German speaking countries. So this also creates a little bit of confusion because even in my country, if I tell somebody, I'm a jaw orthopedist, they think, oh, you're sewing the bones. They think I'm an oral maxillofacial surgeon. So it's a little bit confusing, but then I thought, okay, why is it like that? So I went back into the history and I found out that, in Europe, the schools, especially in German, the German way of teaching orthodontics was to really develop the jaws. This was the purpose. of orthodontics, not to move teeth around and make them fit together, but to develop the jaws because they always had this focus on function. They
Mm.
knew that if the jaw have the right size, the function is correct, and then the teeth, they will somehow align in the right place, or we can even help it, and it will be stable. Whereas in the US, they were also striving for a stable result. And they thought if the teeth fit together perfectly, this is when they stabilize each other. But we all know, we've all seen orthodontic relapse. So I think now it's more going into the direction, okay, if we don't have enough space for the tongue is so much stronger than any retainer we can bond. So we should better focus on proper function. And now it's also the topic of airway and sleep. So we continue to learn. But Stacy, I've been thinking, I don't want to call myself orthodontist anymore. I rather want to call myself a dentofacial orthopedist. Like, that's more like the
It's,
German word.
yeah, it's a description of what is being done. And that is so interesting. I wonder how that all got lost. Um, and it became more of a profession of, moving the white things around in the jawbone, like, okay, here's the jaw that we're dealt with, and we're just going to try to make, whether it's slenderizing the teeth, whether it's taking out teeth, whether we're just going to deal with the jaw that was given to us or presenting to us, versus how can we make the foundation where the teeth are sitting in a more healthy foundation for function. And as you know, and you see probably every day, and I see as a primary care dentist, which let's talk about changing the name of your profession. Excuse me, general dentist. I mean, what the heck does general dentist even mean? So, I do all kinds of things and I like to call it, and Steve Carsonson coined this, primary care dentist.
Mm.
And so I too am working on a name change to describe what it is that I'm doing every day. But when you see a beautiful jaw, I don't even have to look in their mouth. Like, I see a beautiful profile. I see a beautiful, width and profile. And I'm like, go ahead and open. I look in there and of course, beautiful teeth. So
Mm.
the teeth know where to go when you have a beautiful jaw. So I love that you're getting back to basics, back to the foundation of this profession. I feel that European um, practitioners tend to be more open to the functional aspect for sure. When I've had other, whether it's Mariana Evans or just people I know that have a European background, um, they are more open and are kind of trailblazing what is considered extremely new and novel here in the United States with the, you know, orthopedic side of things. But when you go back in history, even in the US 100 years ago, they were really wanting to ask more questions like, why are the teeth like this? Let's look at airway health. Let's look at function. They were addressing mouth breathing 100 years ago. They didn't have the science behind it that we had. They didn't know just how horrible it was for your health to be in a state of mouth breathing. But they knew it wasn't right. Books were being written. They were onto something. And just like almost anything else, something gets inserted in history, like a hiccup of some sort, or just something just bumps something just ever so, off to the right or off to the left. And the trajectory just changes. And here we are, spinning white things around and bone and not really looking at the overall health of the individual. So back to you. I get excited about this. So you were trained. What's the training like in in school where you went in Vienna. Um, what is that? Well, you actually went to
I went to
Roseburg.
Germany. Yeah, it's a little
Yeah,
bit complicated,
yeah.
but I had the great pleasure to study in Germany and Austria. So, for people outside those countries, it might seem like the same country, but actually, I really appreciate the Germans for being very, strict and loving orders, and that really helped me to be more precise. So that was a very good school for me. And in Austria, I also had like my second half of the education I spent here in Austria, which was great because the University of Vienna has like a lot of patients, so you get a lot of practice during your education, which is also important, not just the theoretical part. And I think why I'm here at this point, several reasons, but one is because especially in Austria and Germany, there are a few orthodontists who introduced mini implants to orthodontics. So this was the Austrian orthodontist Heinz Winsauer, but also one who I call my mentor, Professor Benedikt Wilmes in Germany, who published probably the first TAD expansion patient case.
Wow.
So that was, it opened up a whole new field in orthodontics. It brought us back to the orthopedic side of things. And I want to be a trailblazer in providing that kind of treatment for adults. Because usually orthopedics stopped when our patients stopped growing. This is when we said surgery or compromise. So my goal is to provide orthopedic treatment without surgery wherever it's possible. For example, in female patients that are below a certain age, let's say from 30 to 40, usually skeletal maxillary expansion works well without surgery. And this is a huge breakthrough because we used to only offer them surgery, which is quite invasive. And if you have massive problems, like you can't breathe through your nose at all, you have sleep apnea, surgery is probably a good option for you. But if you're, more on the upper airway resistance syndrome side, where it's not that severe, you're a little bit fatigued throughout the day, you don't have as much energy, but you don't want to go through that massive surgery. And now you have the option to also do it with a bone-borne expander, avoiding some of the side effects, the complications that go along with previous ways of treating that. And you can breathe better through your nose, sleep better, feel more rested. A lot of my patients tell me, I don't need a nap in the afternoon anymore. Or when I get home from work, I don't feel completely exhausted. I still have energy to deal with my family. And of course, they get a lot of compliments for their smile because the smile gets wider. So it's the beauty aspect, it's the breathing, the well-being aspect, and of course the bite. But for me, how the teeth fit together is probably, yeah, the least important if we compare it to breathing.
It's so interesting how, so when you were in your residency and learning, I mean, you weren't being taught much airway, were you? This is something that you had to learn beyond your residency on your own, going into, other groups. What started, something happened that you thought, huh, I'm going to look into this other world that exists within orthopedics that I, wasn't taught in school.
Yeah. So to be honest, I started this maxillary expansion journey for adults for the sake of the bite. Because, I was trained a classical orthodontist, the teeth need to fit together. And then my patients would tell me, I don't snore anymore. And I thought, oh, that's interesting, and I'm also very into optimizing my own health. I know how important sleep is. If I don't get a good sleep, I can't be, that version of myself that I want to be. So I thought, hey, if I can help my patients sleep better, how amazing is that?
Mm.
And then, I looked into everything, the research published by Dr. Stanley Liu and Dr. Audrey Yoon, how distraction, osteogenesis, maxillary expansion can reduce the severity of sleep apnea. So I wanted to know all about it. But Stacy, to be honest, till this day, it's mostly my patients who teach me. Just listening to them, listening about their symptoms, looking at their anatomy, looking at the sleep study, and trying to make sense of everything. And of course, I can't solve the puzzle by myself. I need other specialists, ENTs, sleep physicians. So this is why I'm still building this network. And it's so rewarding. You can't imagine if patients come to me and they tell me, for the first time, I have the impression that somebody's looking at it at a whole picture and
Yes.
not just looking through the keyhole of their own profession, not trying to solve the problem just in this area, but trying to connect the pieces. And this is what I want to be for my patients.
Well, they are very blessed to have you as a practitioner. And I think what you just said, and a lot of the amazing guests we have on here that I want the world to hear about, says exactly that. As a healthcare provider, our goal is to step back and look at the patient as a whole person. And we may not be able to help every single thing. That may not be our niche, but we have an awareness and a team that can work with us to maybe help the patient with sleep, a sleep physician, an ENT, our orthodontist, orthopedist. We need that restorative dentist to sometimes help finish the case as well. And again, I truly believe I had a meeting yesterday with a company, the CEO of a company based out of the UK, and they're looking into pediatric sleep disorders. And they're like, we have ENTs, we have sleep physicians. But the more we started diving into this, we have to include dentistry. Dentistry is becoming the front line
Mm.
of this, I don't want to say battle, if you will, but kind of this journey of identifying people that can't sleep and breathe well, that might have craniofacial issues. They see their dental professional more than they see their pediatricians, I mean, and
Absolutely.
their primary care physicians. So it's definitely becoming more collaborative. And
Mm.
you have to collaborate if you really want to help your patients as a whole. But it's training the dental professional to not just look through the keyhole, like you said. It's so easy to just get someone in your chair and you just go straight to the teeth.
Mm.
Pull back, pull back. What do they look like? Do they look tired? Look at their health history. Do they have acid reflux, high cholesterol, blood pressure issues that are medicine resistant, no matter how many meds they put them on. There's just so many things. Children, ADD, ADHD, they're squirming in the chair, constant ear infections, their lips are chapped in the chair. Um, it is just so rewarding. And my team and your team may say the same. Like, how nice is it to walk into Claudia Pinter's office every day as a team member and know that you're not just looking at the white things. The white things are important. I don't want to minimize teeth. We chew, we smile, we speak. Also we're learning more and more that how teeth affect the trigeminal nerve, and there's a neurological aspect to that, even decreasing nasal resistance through tooth function, even cognitive clarity decreases as you start losing teeth. We know that feedback to the brain from chewing and functioning affects neurocognitively. And when you see people without teeth and they don't have dentures and they're not giving that feedback, teeth are important. But big picture. So you start seeing health changes, wellness changes. And once you see that, Claudia, you couldn't go back, right?
No, no, and that's the nice thing. This is why I also know that this, you know, change will happen at some point because, every young dentist that we can educate, that we can make see what's going on and, what could be the reason for totally worn teeth or um, crowded teeth, then they can treat their patients because you cannot ignore it if you know the patient's life is at stake. And I'm not saying, they will die immediately, but, we know that if you don't sleep well, that takes away healthy years of your life.
Absolutely.
Pay the bill at the end of your life.
Well, your quality of life. Okay. So, yes, can someone, an adult, usually it's, well, we do see SIDS, and that is definitely a situation with kiddos for different reasons. But, you know, um, adults can die in their sleep, have a heart attack from unresolved obstructive sleep apnea. That is definitely a thing. So, sometime my father died of sleep apnea.
I'm
And
sorry.
thank you. He was days away from being 64. And a
Mm,
lot of the research I just learned over the years that the average life expectancy of somebody, and I'll have to look at it again, see if that's updated or changed, but I've been in sleep medicine for 20 years, over 20 years. And what was being told to me by sleep physicians in town, the average age of somebody that has uncontrolled obstructive sleep apnea was 64.
mm,
And
mm,
my dad was days away and he couldn't wear a CPAP.
mm.
So I made him an advancement device, which is my whole story, why I even got into this. But, and it was on the sink that night. Now,
Mm.
could there be cumulatively, my dad had other health problems as well. But why did my dad have all these other health problems? So my dad did have heart disease. My dad had high blood pressure. Um, he was exhausted. My dad was a mouth breather
Mm.
and he couldn't breathe through his nose, he said, ever since he was a kid.
Yeah.
And then you just go back, right? Like,
Yeah.
what if we could have gotten to my dad and figured out what the heck's going on with my dad? Why he can't breathe through his.
Mm.
And then it just starts off with one health change. And then the body, you kick the body off its normal healthy path. And there's all these compensations that happen as a result. So, but quality of life, let's like my dad is the extreme of what happens when you don't control obstructive
Mm.
sleep apnea. But let's just go beyond the word obstructive sleep apnea. I think we're going to find, Claudia, over the next 5 years, what even obstructive sleep apnea, I don't even think we really know what it is. I think there's a lot of gut health, inflammation, neurology that is leading to obstructive sleep apnea, because you can have a very small, skinny person with a big airway that has OSA that just defies the phenotype of obstructive sleep apnea, the typical phenotype of the overweight person with a small airway. So
Mm.
there's a lot going on there. The nose is a huge influence
Mm.
on the collapsibility of the airway, feedback, resistance, neurology. The nose controls a lot, even downstream.
Absolutely.
You are affecting the nose. I believe too, the more I'm learning, how you're influencing the nose through your bone expansion, we're going to find out is going to be influencing things in ways we never even knew, beyond just, oh, I feel like I'm breathing better. Uh,
Yeah.
so I think there's a lot coming that just makes your job, my job, that much more important. So you start doing this, and then you decide, not only do I love doing this for my patients, I have to teach other people how to do this. So you developed courses. Is that correct?
Yes. And the story you just told, I reminded me of a patient that I had,
Ooh,
before I was aware of the whole Airway thing. So funny, funnily enough, he was just the same age as my husband, but like when I looked at him and like he's the same age as my husband, like they look like they're 20 years apart.
yes.
And he had, crowded teeth. And, I said, yeah, let's align them with aligners and stuff like that. And the result came out beautiful. He was super happy. And then years later, he came back for his retention checkup. And this is when I was already sensitive, like when I knew about Airway. And then I asked him, do you have problems breathing through your nose? And yeah, no, can't breathe through my nose at all. Do you snore? Yeah, I snore heavily. I have been diagnosed with sleep apnea. Okay. Do you do anything about it? Do you have a CPAP or stuff? No, I can't tolerate the CPAP. I just sleep like this. And I thought, I was just looking at the teeth. Okay, I didn't see the high arched palate, although it was there in my face. I didn't see the narrow maxilla because there was no crossbite. So for me as an orthodontist, I thought, fine.
Right, right.
Um, I could I could have told him back then, before he committed to a treatment where he spent a lot of money to get his smile, that he could also do something for his health, for his health, for sleep. We could have improved his nasal breathing through maxillary expansion. We could probably get him to a point where he could tolerate CPAP because,
Right.
if you can't breathe through your nose, usually also the CPAP is not as comfortable. And I really missed that boat. And I was so, so sorry because everybody who studies medicine, we do that because we have this urge and wish to help people get better. And I felt that I completely missed that chance. And now I ask everybody I screen everybody for nasal breathing, snoring, and things like that. And I always explain, healthy breathing starts at the nose. And that's a beautiful thing of being a dentofacial orthopedist, because if you look at where the maxillary bone is, it's here. Okay, it's forming the floor of the orbita, and it's like the nose is inside the maxilla.
Yes, the nose is
So
inside the maxilla.
exactly. So the
Well said.
ENT can only, he can straighten the septum. It's like living in a little flat. The ENT can move the furniture around, straighten the septum. He can even take things out, but maybe those things are supposed to be there. Like you can throw out your bed, you need the bed. But as an orthodontist, orthodontists are the only people who can make the flat, the house, bigger by expanding the maxilla, because the roof of the mouth is also the floor of the nose. So if we expand the maxilla, the nasal passages also increase in volume, and then breathing gets easier. And my patients tell me, usually when I got sick, my nose was completely blocked, no air flowing through. And now, after maxillary expansion, even if I can get sick, I can still breathe through my nose. And to be honest, this is the most uncomfortable thing about being sick, next to having headaches or something like that, not being able to breathe through your nose. It drives
Yes,
me
it
crazy.
is so uncomfortable to be a mouth breather. It,
Yeah.
when I am sick, I think in that moment, I'm like, this is what people feel like walking around, mouth breathing all the time. It is a horrible feeling. And I don't, this is, gosh, I told this story a couple of podcasts ago about a patient that couldn't tolerate the CPAP. He wasn't a candidate for Inspire because he also had some central apneas too, but he vaulted palate. He looked exhausted. He too looked 20 years older than
Yeah.
what he is, but his mouth, he started getting crazy cavities. And I'm like,
Mm.
golly, so dry, so dry. His mouth was so dry. And that is a miserable feeling to have a dry mouth, a miserable feeling. So there's all these health ramifications. I was talking to Karen Parker Davidson, Dr. Karen Parker Davidson, and I she's affectionately, Mike DeLuke calls her the nose nerd, and she loves it. But she is brilliant on the nose, and she's like, she has over 60 known functions, 60. And then I talked to her yesterday. She was actually, her book's coming out with the 60 functions. And she's like, I got to launch the book, but I have found three more. So 63, she's up to 63 functions of the nose. And we've always known there's about 30. And she's found 33 more. She's brilliant. But it really is. And I'll throw in Stanley Liu. You know, we had Stanley on the podcast a while ago, and he said something. He goes, "Who are the rhinologists? Like, who's affecting the size and shape of the nose in a small child?" That would be your orthopedist, dental or dentofacial
Absolutely.
orthopedist, your orthodontist, your dentist. You know, an ENT is definitely, gosh, so needed. Allergists needed in that young child, but no one's going to do massive surgery on a nose in a child. So the only way you shape the nose in a child is through reshaping the maxilla, which is where the nose sits inside. I love how you said that. The nose sits inside it. Um, I mean, look, as practitioners, we have patients in a Rolodex in our brain that once we figure something out or we have our aha moments, we think back and we go, oh, that would have helped that one guy, or that would have helped. So we all have those, oh, wish I could have got to somebody um, sooner, or wish I could have intervened, wish I knew then what I know now. But, you know, that even happens when you become a mother. Oh my gosh. Oh, the mom guilt, you know, wish I knew when my kids were really little what I know now. But it is what it is, and we're moving forward, and you're helping so many people that are coming your way. Um, if somebody wants to be a patient of yours, I wrote it down, your website. So it is Claudia Pinter, ClaudiaPinter which stands for Austria. So that is your website. If
Mhm.
somebody is wanting to come have a consultation, and you have patients that come from all over the world to see you. Um, so I will also put that um, in the link in our podcast. But will you go into your coursework for the listener that is a practitioner that wants to learn this, or
Mhm.
maybe they even want their practitioner to learn what you're doing in their town? You know, they're like, I don't know
Yeah.
that I'm going to go to Vienna, but I
Yeah.
sure wish my practitioner would learn from her. So
Absolutely.
please tell us more about your courses and how people can find those.
Yeah. So I get so many requests for courses because, I have an Instagram account that is very educational. It's geared towards colleagues because I just love to share. You mentioned earlier about, constant learning. For me, teaching is my way of constant learning because I need to really scrutinize my own treatments. And if you try to explain to somebody else, you really need to know your stuff. But the course that I launched together with Dr. Stanley Liu really came from our mission to make maxillary expansion for breathing, bite, and beauty more accessible for patients and for colleagues because colleagues want to learn it. They want to serve their patients well. And in our course, we deliver the why and how of maxillary expansion for breathing. So if somebody wants to learn, okay, what's the mechanism? What causes snoring? What causes an obstruction of the airway? And how can I help? This is the course to go to because it also then accumulates in an in-person course, which is taking part in March next year, where colleagues are invited to my practice where they get hands-on experience. They see me doing the procedures on live patients,
That's
and they
great.
also get to practice on bone models, so they can actually do the procedure in a safe environment, in a model of bone and teeth. But they can also watch me do it live, because it's always different to do it in a real patient, and I want them to be there to feel confident when they do it in their patients, so that they've seen everything, they know everything, and they can handle the situation.
So you have a hands-on component, which is so important. Golly, I mean, I remember when I was learning dental implants, you can go take a course, take a lecture, watch someone else's procedures, but you really have to hold it in your hand and feel it. And at least for me, that's how I learn best. I think a lot of people, especially, I mean, in dentistry, we are a very surgical, mechanical, hands-on science. So we're doing microsurgeries all day long on teeth, and so having that hands-on component is super important. So that's wonderful.
Yeah.
So you have two of them. One is purely an orthodontic course. Is that correct? Like,
Yeah, that is with Right Global. So if somebody is more interested in how to become proficient with aligners, and this is then the perfect course. But if somebody wants to know, how can I do expansion for better breathing, the Dome course, you can find that on domecourse.com. It's a website. You can enroll. The webinar series started already, but you can also join late and watch the recordings, and there are 5 more sessions to come where you can join live. Is really, why do we do expansion? For nasal breathing, how does nasal breathing affect the breathing during sleep? Dr. Stanley Liu is teaching about his extensive experience in sleep surgery. So he really brings the components from otorhinolaryngology, everything that's happening past the teeth and above the floor of the nose. And I will be teaching the technique, how to do it. So they have the theoretical knowledge, why and how to
and
implement
then
it.
the how to. And do you go into like screening, like what patients would be candidates for something like this? I'm assuming, of course, you would do that, but I think that's so important for people to understand. And the reason I say that is you might have clinicians that don't necessarily want to do the surgery themselves or the procedure themselves, but they want to learn how they can better collaborate. And I'm a big fan of this. Take the course. You don't have to be the one that does the surgery, but if you take a course, and we
Mm,
have courses in ASAP Pathway too, I tell people they'll come to me and say, but I don't think I want to be the one that does the MARPI, and I'm like, that's okay. But you need to understand who the candidates for this procedure are.
mm,
Maybe bring a specialist with you so you
mm,
can learn together and build your team. And then you now can set up the case. Basically, you know who the candidates are, you can screen, refer appropriately, and now you're that much better of a clinician.
mm.
So learning about something doesn't mean you necessarily have to be the one doing it, but it makes you a more well-rounded, I feel, also better at identifying the patients that need it in your practice to refer to somebody in your town that
Mm.
is willing to do it.
And I'm imagining, like, imagine you're a young dentist starting your career. How can you set yourself apart? I'll give you one thing. Just ask your patients, how's your sleep?
Mm.
And they'll say, why is my dentist asking me about sleep? But then they start talking, and this is when the patient gets the impression, wow, this doctor is caring about me. The rest doesn't matter if you do MARPI, as you said. This patient will refer 5 more patients. And of course, you cannot just ask about sleep and then know nothing about it. But if the patient then says, yeah, I'm snoring, and then you can explain, well, did you know how the snoring actually occurs, and treatment options? I mean, you can even do a snoring device, a mandibular protrusion device. But this really, I think, will help young colleagues to establish themselves.
Agreed. I think it sets you apart and it shows that you care about them as a whole person. And at least in the United States, I want to just say, I'm appreciative of the American Dental Association for making, back in 2017, they made screening sleep and airway health should be a standard question for
Mhm.
adults and children in a dental practice because they overlap so much within our profession. It is almost an obligatory, you have to understand this on some level. You have to start asking these questions because we know too much within our profession to not include this in part of our questioning and just overall wellness of a patient. And I tell people this: sleep is not a passive, lazy thing. I have patients that brag, I sleep 3 hours a night and I do just fine. Imagine how much better you would be. I'm sure you are just chugging along, Bob, but if you had 7, imagine
Mm,
how much better. And not just 7, but 7 good hours of sleep. If you live to be 90,
mm.
you were designed as a human being to have slept 30 of those 90 years. So sleep is not lazy, it's not passive, you're not missing anything. You're
Mm.
missing something if you aren't sleeping 30 of your 90 years. The other
It,
60 years are not as good if you're not
it,
sleeping those 30.
it's a principle, don't you think so? Like, I mean, it doesn't matter if you're believing or not, but even God rested on the seventh day.
That's right.
Who are we to think we don't need to rest?
That's right. That's right. We were designed to sleep. Sleep is how we heal, how we
Mm.
recover, how we remember. And more and more research is coming out about dementia and the cleansing effect that is occurring in stage 3 sleep. Your brain has a bathing system, it has a pump, it is flushing, but it only does that in your sleep. So your brain gets sticky and cobwebby and it doesn't work well. So, those of you that are bragging on your lack of sleep and how great you're doing, I'd love to see how your day goes if you had absolutely no caffeine in the morning and tell me that you can function just fine on 3 hours of sleep. They're stimulating themselves all day long with like they're doing nicotine packets, they're doing, Red Bulls and Alani News and coffee and Starbucks, and they think, yeah, I sleep just fine. So if I remove all those stimulants, I'm just curious how your life would feel.
Mm.
Um, well, thank you so much for being here today. You are a pleasure and just a treasure in the world and helping so many people, and now helping more doctors learn this technique too. And I always end with my 3 questions that really have nothing to do with what we just talked about. But um, here we go. Pancakes or waffles?
What's the difference, anyways?
Oh man, I forget. You're not okay. Let me just explain this. I went to Germany when I went to Germany this summer and I went to the breakfast bar. I was blown away that it is almost a keto, it was like a keto diet, like 15 different sausages and meats, cheeses. I didn't even know that there were that many cheeses.
Yeah.
And then they had the Americanized Western tiny little table off to the side, like, hey, for you Americans, here's some bacon and eggs and maybe a waffle or something like that. Okay, a pancake. It's like a little flat breakfast. I don't know
Yeah.
what to call it. It's a little flat, and you put syrup on it or
Yeah.
butter on it. And then the waffle, it's like corrugated and it has
Yeah.
all these
Yeah.
little squares. Do you know that you probably don't eat either one of them then?
Exactly. But I will tell you my version of my pancake I eat in the morning. So it's two eggs, sometimes just one egg yolk and two egg whites, and then some banana and cinnamon. And for me, it's the best. So
Okay,
it's
wait, how do you
coating.
make that? So you whip it together and you throw it.
Yeah, I scramble the eggs and then cut the banana, a little bit of banana in, and then some cinnamon, and then just in a pan and
Wait,
stir it
you
and put it
mush
in.
the whole thing together? You just cream
Yeah,
it up. You cream it up? Ooh.
nothing fancy. Like it's done in 10 seconds. So,
Okay,
but
so
it's
I'm gonna
delicious.
ask you to text me a picture of your banana whatever. And I love banana pancakes, but I put bananas in my pancake. So you just don't have the flour, which is so much
Yeah.
healthier. It's a whole food pancake. Well, all right. So I've learned something new today. I got to have a picture of this, Claudia. Okay, I know you have pizza. Okay. What is the best pizza topping combo you can think of that you love?
I think it can only be tomato sauce and some cheese, not nothing more.
You just are a cheese pizza girl.
Well, I think with cheese pizza, okay, cheese pizza in America is pizza and cheese and cheese and cheese.
Okay.
And in Austria or in Europe, it would be like the pizza dough, tomato sauce, and some cheese. So in like whenever I'm in the States, I always order like, can I have less cheese? So that matches a little bit what I'm
It
used
is.
to.
It's more of dough. Would you like a little pizza with your cheese in America?
Yeah.
That is how it is. We overdo kind of everything here. I will say when I went to Germany, the kids, man, we had a great time eating all the different foods there. Uh, we definitely were. I'm not a sausage person, so I was like, oh gosh, so much sausage, so much sausage. But they had something called, I think it's called a Donner, oh shoot, it's like a gyro.
Oh yes.
How do I say that?
Döner.
Yeah, it's
Yeah.
got a little umlaut or something in there. It is so delicious.
Mm.
I cannot find that. The kids were like, we are so happy you took us to Germany, but that is literally their favorite thing about
Yeah.
Germany.
Yeah.
It's very fresh and delicious. It was so
It's a Turkish influence. If you had Turkish immigrants, you would have döner.
okay. Well, I mean, in St. Louis, we got a lot of Italian, we got a little German here. So yeah, we're not doing well with finding one here
Yeah.
in St.
I
Louis,
had
Missouri.
the fried tortellini, or what's the special dish in St.
Oh,
Louis?
toasted ravioli.
Toasted ravioli. Yeah.
Yeah, if
That
you
was
come to St. Louis, toasted ravioli. It's basically ravioli and it's breaded and then it's like fried and then you dip it in marinara sauce. It's so good. And then
I
we,
had
oh, go ahead. Go ahead. So what did you think?
no, I had to tell my husband once I had this toasted ravioli because he's Austrian, but he's really feeling more like he's born in an Italian body. Like if you wouldn't know, you would say he's Italian. He speaks fluently Italian.
Oh,
So
really?
I'm not even allowed to cook spaghetti at home because I would do it completely wrong. Okay, this is the
Don't mess it
level.
up, babe. You're messing it up.
And then I told him, I just had toasted ravioli, and he was like, "How can they?"
I know. They ruined it. Hey,
No, I think it's beautiful because they take something and they make something new out of it. It's American, Italian. It's this melting pot bringing two cultures together. I think it's a new
yeah,
creation.
it's a deep fried Italian dish that, the Italians probably cringe, but it is definitely, we have a huge Italian community in St. Louis, this place called The Hill, and great Italian food, but toasted ravioli, gooey butter cake is a big thing in St. Louis. So I don't know, they probably shoved all the St. Louis food at you, but or pork steaks are big here. People love pork steak. But whenever I have someone that's never been to St. Louis, I'm like, okay, we gotta go get you some toasted ravioli. It's
I'm glad I had it. It's an experience.
it is an experience, and I think people are underwhelmed when they have it. They're like, oh, that's pretty good, and we make it out to be so much more than it really is. Okay, my last question: what is your favorite thing to do on your day off?
working out. I really love to go to the gym and lift weights.
Good for you.
Love it. I have someone who's, pushing me, and it's just the best. Really do something that's really hard and you feel like you want to cry because it's crushing you, and then you come out so much stronger and you think, made it.
I did it. I know you accomplished it. Good for you with weightlifting. It's so funny. I've been really doing that more myself as well, but
Amazing.
with my age now, it's being highly recommended that I lift weights for bone strength, but you're finding more women are lifting and it's good. It's good for our skeletal structure. If you don't
Absolutely.
use it, you lose it. So it's really good for bone density and overall health and building muscle. So good for you. Good for you. Well, I've had a wonderful time talking to you today, and I look forward to following you on your journey. And thank you for joining us. I'm sure the listener listening today has gotten a lot of what you had to say. Thank you for sharing.
Stacy, thank you so much to you and to your whole team for having me. It's been a huge honor, and I think it's so important what you're doing. Treating the kids is the most important thing. Anything I can do to support that. And thank you for this wonderful time and getting to know you. It was a pleasure.
Absolutely same. And anything we can do to support you too. We're all in this together. We help more people. We're stronger together than we are as individuals. So thank you for all you're doing. And thank you, everybody, for joining us today and listening. And we will see you next time. Bye-bye.
Bye.
This podcast would not be possible without the inspiration of my dad, Daniel Becker, and creative direction and editing from the very talented Jason and Dane Becker, Ben, Lydia, and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And please remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice or to replace your healthcare provider's diagnosis or recommendations.